MAGA say they would be paying more than $4,000 a month, even with help from their private insurance.
This is our medication that without the Medicaid coverage would be $3,200 a month.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these stubby nuts in the back, you know, but why? Why when we put food on their tables? Trump promised a lot of things. I thought it would be more family values and those programs that really need here.
If they cut our Medicaid, we would lose every hospital in our rural area, and then none of us would have health care. Not just the people on Medicaid, the people who have private insurance and Medicare. I'm a pharmacist. We took an oath to take care of people. We didn't say, no, only the rich ones.
I was complaining about Trump after the whole autism Tylenol thing to a coworker, and I was like, I can't believe we're only a year and a half in. Like, we're not even halfway through yet to his presidency. She looked at me, she was like, girl, we're 9 months in. I was like, 9 months. I have never felt more pain than I did in that moment. I was like, 9 months of this 3 more years of this no, that's not gonna work for me.
Every hospital you go to in these coal counties will tell you 70% of their money comes from Medicare and Medicaid. So if that goes, we're hurt. These hospitals won't stay if they can't get that money. The big beautiful bill, it's going to shut healthcare down as we know it in these rural areas.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
So the Democrat leaders in Washington, D.C. are threatening to shut down our government. Yes, our government.
So, hey, to be fair, even the president himself has said in the past that shutdowns are a responsibility of the president. But I'll tell you what Democrats are doing. They are saying, hey, there are things that are important that need to be in this budget for American citizens. What are those things?
Because Republican legislators are refusing to fund $300 billion for healthcare for...
You're on the right track. You're doing great. Keep going.
Illegal aliens. If that isn't anti-American, I don't know what is.
Oh, you were so close. You were so close. This actually has nothing to do with undocumented immigrants. What Democrats are pushing for is for expanded subsidies, which are basically premium tax credits that expire at the end of 2025 to be extended. If those are not extended, then premiums are going to skyrocket and 2 million Americans are going to lose healthcare coverage completely. As far as your claim about undocumented immigrants, that is so far from the truth because undocumented immigrants are not eligible for purchase of healthcare on the marketplace. They're not eligible for any of the Affordable Care Act subsidies. That doesn't apply to them. They don't get it. And the $300 billion, I'll give you a little bit of credit because you got the number right, but you're way off the mark for what that number actually is. $300 billion is the estimate to keep the ACA subsidies in place for the next 10 years, to keep American citizens, United States citizens only, to keep their health care. And before you come back and say that undocumented immigrants do get some benefit from ACA, no they don't, zero whatsoever. They are not eligible. What you may be talking about are state level programs that some states allow those groups to have access to, but that has nothing to do with the federal budget. And respectfully, this information that I just gave you is so easy to find. Feel free to fact check me. Hope this helps.
I have Medicaid. If you're getting Medicaid or you're getting SNAP, those things are being taken away. The people that are being affected are the elderly and the children. I see over and over again, they're making it harder and harder. The applications are harder. Just to talk to a representative is harder. The mental stress is out of control. I have a good job and I can do this. No, it takes more because it's very disheartening. I'm just gonna go to work. They're gonna take all my money, right, taxes, and then I can't even get any services that I qualify for.
Right.
So,
Hey! Yes, I just found out that I'm like dying. Oh my god! Wow! Yeah, like I need to get this surgery, or I'm gonna die. Yeah. No, totally. So can I can I get that? Yeah. And how much did you work this month? How much? I'm sorry. Yeah. So we just made a new rule that like if you want to deserve to like live, you need to be working 80 hours per month and like report that on our portal. Why? We're just trying to make sure that people aren't like taking advantage of our system. You know, like there's all these like able-bodied young men who aren't getting jobs. They're just like sitting on their couches playing video games. You know, like there's like able-bodied male.
Able-bodied young man.
Able-bodied young person living in their parents' basement.
Living in their mom's basement playing video games. I'm sorry, you got to go get a job.
Just young men with able bodies. You know, they're just everywhere. Okay, well, I do work. I do have a job already. I see that. It's just not always 80 hours a month because like my employer controls my shifts. If you don't work 80, you would then die. Am I making sense? It just feels like an extra hoop to jump through for this thing that I like really need. Bro, it's just like these able-bodied men, right? They play video games, refusing to get jobs. Oh, I was just laid off. Do you have a job for me? Not contributing to society. I'm retired and also disabled. You die as well, you know? Okay, I'm sorry. It feels like most people on your services are already working or like have a valid reason why they can't work. Yeah. Like 92%. 92. Okay, so these work requirements, they don't even... No, they don't increase jobs. Okay. No. Actually, they just make life worse. So why are you doing this? Yeah, so this is all so that I can spend less money on you, so that I can take that and help me and my rich friends pay less taxes. Thanks, Ben. Okay, so he's literally playing video games on a couch. Listen, bro, you gotta stop being so lazy. You know, you can't just like sit back and expect the system to be rigged in your favor so you can get handouts for the rest of your life. Thank you so much. You know, it's like people like you that you just like take and you take, right? It's like I'm honestly sick of the fraud. You know, thanks a lot, bro. It's like, you know, if you really want to live, like maybe like get off your butt and like thank you so much, start working for once in your life and contribute something to make society better. You know, thank you so much. Oh my God, I won.
You were telling me that people are unaware. They're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair. Which, I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me. And they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way. And they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
It's September 12th, and if anyone was wondering, Medicaid no longer covers Planned Parenthood services as of today. Thank you to the federal government and their big, beautiful bill. So if you are one of the 1 million people that was using Planned Parenthood for things like STD, STI screenings and birth control, there's that horrible update. I know that Planned Parenthood nationally is still suing and taking the federal government to the courts based on this. But as of today, Friday, September 12th, Medicaid will no longer cover services. The Planned Parenthood closest to me in North Carolina posted on Instagram that they are still welcoming anyone to walk in the Planned Parenthood doors. And if you are a Medicaid recipient, they will walk you through what your options are. In the meantime, I'm going to be looking around and seeing what free services are available in the state of North Carolina to post them here to act as a resource for those who are using Planned Parenthood and or Medicaid recipients. And if you know of any, please comment them below.
People who's in favor of Medicaid being cut drastically and think it's not going to affect you and in fact it's going to help you, I want you to honestly think about all of these things. Medicaid is a major funding source for many hospitals, including rural and community hospitals. If they no longer have Medicaid coming in and you have patients coming in with emergencies, you still have to treat them. You still have to treat people whether they have insurance or not in an emergency. So now that people are still going to be getting the same care, but now the hospitals aren't going to be reimbursed. And if hospitals aren't getting reimbursed, they can't keep the lights on. They can't pay their staff. They can't get the supplies, the equipment. Is this all making sense? So then they can't pay anyone and they have to shut down. And you're like, great, but we still cut Medicaid. We're saving all this money. Okay, so now the hospital is shut down, which means everyone's going to have to divert to the other hospitals, which may not be close. It may not be close. If you're also one of the people who's proposing that more women should get pregnant and have babies, where are the moms going to go to deliver their babies? What if they don't have a hospital nearby? What if they don't have access to care? Or if they can't get in anywhere? Because when more hospitals close, right, they're going to have to divert to other places. What do you think is going to happen with the wait times? Now you need to go to the hospital for some reason. You have insurance. How much longer do you think you're going to have to wait now that there's no other hospitals nearby because everyone's going to one place? The wait times are going to get longer. The healthcare staff is going to be stretched more and more thin than they already are. The hospitals aren't going to hire more staff. They're just going to stretch the staff thin. And care is going to decline. It's going to take longer to get care, and the quality of care is going to go down for everyone, not just people with Medicaid or who don't have Medicaid. No insurance at all. It's going to affect everyone. Do you know how many children have Medicaid in this country? Not only are women and children going to be affected, but we keep talking about how we have a mental health crisis and we're in a mental health epidemic. What do you think is going to happen when mental health facilities and mental health units are being shut down? Where are these people going to go who are in crisis? Where are these people going to go when they need a mental health provider and there are none? If we think we have a mental health epidemic now, wait until Medicaid is cut, because how many people who get behavioral health services have Medicaid? Not all people, but a lot of people. So there's a trickle-down effect. There's more than just a simple, we're cutting Medicaid and it's going to save us money. Think about all the money it's going to cost for all these things, let alone not just the money, but these are people's lives. So what do we think about homelessness? What are those rates going to happen? Incarceration, people with a crisis, maybe who's feeling like they don't want to be alive anymore. They might not have somewhere to go. So just think about it.
3 years ago, Heather Payne was a career travel nurse, but while between jobs and insurance, she suffered a debilitating stroke while at home in Dalton, Georgia.
I wasn't able to work. I was too sick at the time.
Like the new national work requirements, Georgia's Pathways program adds steps and paperwork for people seeking Medicaid, allowing flexibility in determining what qualifies as work, as well as some exemptions. So Payne started taking classes, but learned she was still not taking enough credits to qualify for health care coverage. Ben Summers, a Harvard professor, says Georgia's program created so many paperwork challenges that it prevented people from getting coverage who would otherwise qualify.
Might what we saw out of Georgia be forecasting what's to come in the rest of the nation?
I think there's a real fear that what we saw in Georgia is going to be the same that plays out nationally.
The state of Georgia initially estimated roughly 50,000 residents would have access to Medicaid through Pathways. Today, just about 9,200 people are covered. And then there's cost. In Georgia, upgrading the verification system for work requirements cost more than $50 million. Just 4 times that, $200 million, has been allocated for the national rollout of similar work requirements. Some health policy leaders say that amount of funding alone could lead to a very rocky rollout. In a statement to NBC News, a Centers for Medicare and Medicaid Services spokesperson said in part it's committed to implementing the policies on time, consistent with the administration's focus on promoting self-sufficiency and preserving the program for the most vulnerable, adding that the agency will be monitoring states for compliance and will provide support to ensure eligible individuals remain enrolled and those no longer eligible do not continue to receive services. While Heather Payne finally has insurance through her school, she says the lapses in care caused permanent damage to her health.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues.
The latest news about Medicaid cuts has Americans outraged. Millions rely on Medicaid for healthcare access, especially in rural communities and low-income households. But here's the kicker. Many of the same politicians and their MAGA supporters who once cheered for budget-slashing smaller government are now facing the reality of what that actually means from viral clips of families panicking about losing coverage to angry rants online about higher medical bills. The reaction is spreading fast. And for some, this is just another brutal reminder that when you vote against your own interests, you find out the hard way. This video breaks down the growing backlash, the hypocrisy and the outrage, and why Medicaid cuts show Americans once again what FAFO politics really looks like. Here's the bottom line. Medicaid cuts don't just impact numbers on a budget sheet, they impact real people, real families and real lives. And while it's heartbreaking to see people struggle, it's also impossible to ignore the irony when the loudest voices against government programs are now the ones crying out for help. This is what happens when ideology collides with reality. Medicaid cuts aren't abstract, they're devastating. And this is FAFO, plain and simple. If you believe healthcare should be a right, not a punishment, then hit like, smash that subscribe button, and join us here on the Progressive Democracy, where we keep exposing the hypocrisy and fighting for accountability. Thanks for watching. And remember, every time they FAFO, we'll be here to break it down. Just a quick note, full credit goes to the original creators of these videos. Enjoy your day. See you on the next one.